So, good afternoon and welcome to Mind and Body Wellness Live Health Talk. We're on episode 14. I can't believe it. I've got that many behind us. And we're really privileged to have Amanda Scarfe here. She calls herself Amanda. um, let me just get it right, from the Education Programs for Patients initiative. So she's the coordinator and quality assurance lead, and the EPP program is part of GAVO, which is the Gwent Association for Voluntary Organisations. And really, it's great that Amanda can talk to us about living with fibromyalgia. She speaks from her own personal account, but obviously she's a witness to the course that they have available and can tell us really tips on how to manage it and how to mitigate the symptoms and just really make it more bearable, I suppose, and life worth living. So
A
all
very
those
good way to
things.
put it.
So thank you very much once again, and hand it over to you. And and we're very, very interested in what you have to share with us. Thank you.
Oh, thanks, Esther. Thank you. Yeah, it's lovely to be here again. I was here on the first one, and now I'm here on the 14th. So it's nice to come back. It's nice to be wanted.
I
Um,
forgot that you were the
yeah,
first one on pain management, which was really, really enlightening, and very, very interesting.
yeah, absolutely, absolutely. But fibromyalgia is one of those conditions that it seems to be popping up everywhere. It's not popping up everywhere. It's just actually people are getting diagnosed now. Whereas it was a case of I don't know what's happening previously. And that was nothing to do with doctors or anything like that. It was just it wasn't known where it came from, what happens, what it is. And it's now been featured as a condition under NICE guidelines, which puts it as an actual condition on itself and not just a mixture of other conditions then. So fibromyalgia is a condition which causes an intensified sensitivity to pain. It's quite common, and up to one person in every 25 may be affected. I think that's actually gone down to a bit less as well, actually, at the moment. So more women than men are affected, but men definitely are affected by it also. And it usually occurs in young or middle-aged women, but can also occur in men, children, and adolescents. It can vary how people are affected by the condition, and many people have flare-ups from time to time when the symptoms become suddenly worse. The exact causes of fibromyalgia are not known, and no specific cause has been found as yet. They will at some point, I'm sure. But sometimes the condition runs in families and is genetic. And one theory is that chemical changes in the body's pain pathways take place so that the person feels a different kind of pain to somebody who suffers, let's say, with a physical injury or something that's slightly different. So the pain can be long lasting and chronic, and there's no easy way to stop the pain. What we do know, though, is that pain is not caused by inflammatory or degenerative arthritis. It doesn't cause lasting damage to the body, and it is not dangerous or life-threatening. However, as the symptoms are persistent, it can be difficult to cope with and can be disruptive to a person's life. Certain conditions may contribute to developing the disorder, and these can include things like poor sleep, an illness, accident or injury, and emotional stress or trauma may also contribute. And that's where I think mine has come from. It could be a number of my other conditions have had onset of it, but I had a lot of emotional stress and trauma around the same time as it developed. And therefore, I think that would be one of the causes. Obviously, I'm not 100% sure, but that is in my personal, my toolbox of things that I think has happened. So we're going to go through a couple of little things. So fibromyalgia, or fibro as I'm going to call it from now on, because it's much easier to say, it can be difficult to diagnose as the symptoms vary considerably, and they could have other causes. So there is no specific blood test, X-ray, or scan to confirm a diagnosis of fibro. So most conditions have have a way of saying, yes, you have this, yes, it's not. So blood tests can rule out other causes, and it can support a diagnosis, but it's important to consider that having widespread pain that lasts 3 months or more, fatigue or waking up feeling unrefreshed, and problem with thought process, as in memory or focusing and concentrating, can all be a part of fibro. There are many other symptoms also that we're going to go through a couple today. So fibro can vary from person to person, and for some people it can improve significantly with the right approach to managing it. And many people live very successfully with a long-term condition, but rarely have a complete cure, and will usually have some periods of time where the symptoms flare. So we cover a lot of things. We have a specific course for fibromyalgia. It's called Living with Fibro, because think about them words. When you're describing it to somebody else, the majority of people say, I suffer from fibro. We don't want people to suffer. So let's live with it. Let's make it better. Let's make it into the positive. Let's see what we can do to help ourselves. And that is what EPP do. We provide self-management programs to be able to help you manage your health condition. So you can learn about fibro and the way you can manage it, and you can share that information with your family and friends so they can support you. We also look at things about like ways to improve your sleep, doing some exercise every day, even if it's just a little, to strengthen your muscles, improve your posture and become more active. And we look at pacing yourself, working within your limits to break up tasks into smaller sections, if that helps. And catch up with some activities on good days so you can rest when you feel less able to be active. You can look at relaxation techniques, trying to do something you find really relaxing each day, especially before bedtime, because that's the time when most people start to feel their symptoms again. And practicing mindfulness can help as well. One most important thing, though, is keeping up with your social activities if you can, and try to stay connected with friends and family, because having long-term pain can make you feel really isolated, and it can lower your mood, so you can try and keep up things that you enjoy. Now, going through my story a little bit, I was diagnosed with fibromyalgia in 2012. I suffered with it. I suffered with a lot of things back then. There was a lot of anxiety and depression, stress. I had another number of other health conditions, but we couldn't put them into a place with what symptoms I was having. So I was told that I had fibro. I refused to accept it. But by refusing to accept it, I actually made it worse because I just ignored it, because I didn't want anything else added to my list of conditions. I wish I'd listened, but we live and learn, don't we? And what I did then was probably around 2018. So I kind of ignored it for a couple of years. But 2018, things started to go a little bit pear-shaped, shall we say. So I started forgetting things. I started losing my balance. So much so that I slipped on a little tiny piece of gravel in work, and that has had a detrimental effect on everything. So it set off other conditions. I was on crutches and then in a wheelchair because I lost my mobility due to it. I found out then that I had osteoarthritis. Everything was all jumping on top of each other. So I thought I didn't want to live anymore. So planned to end it all. Because I thought, what's the point if I have all these symptoms, I can't do anything about them, everything is getting worse. I lost my job through it because I could no longer be reliable enough to be in an office environment. And so I lost everything. I lost a relationship as well through that. So at some point, somebody put me in touch with EPP. I went on a course and something changed. The way that I thought about my condition changed. I no longer suffer with anything. I live with my conditions. And I do have a long list of conditions. I play condition bingo. Every time I go to an appointment, it's like, what have I got now? So, it feels like that, but I don't take it as negatively anymore. Everything I have, I can help myself. I'm not in a wheelchair anymore. I walk around with crutches, but it's much easier. I can walk further. I can do more things. I never thought I'd be able to speak in front of people. Here I am now. There's all these things that have changed since being on an EPP program. And I'm not just saying that because I am the coordinator. I am the coordinator because I came on the course. The course helped me learn about my conditions and to how I self-manage. So the things like fatigue, looking at fatigue can be a huge thing for many people, but it's not just physical fatigue. There's emotional and just your mental well-being in general can be fatigued by living with these conditions because it's a lot to deal with. And especially when we get isolated and start to feel like we're on our own and we have no help. So it's the good thing is to join a support group and just reach out and get some others' opinions on what's happening. Anything that's not normal for you should be reported to your GP or your healthcare professional. And that can also help with fatigue because it takes that emotional pressure off you. But if you are struggling with fatigue, then look at things like pacing and planning. So plan your day out. Have a look to see where there is times that you can rest, and you have to plan in rest. Don't just think because you're feeling good that day that you can keep going, because you will then have the repercussions days after. So we look at breaking it down. So for example, when I need to hoover, which I do struggle with, I do it a room at a time, but I don't do it one day after the other. I do it, I'll say I'll hoover the living room on a Monday. I'll do the hall on a Wednesday, my bedroom on a Friday. I will spread it out, because if I over plan and do too much, put too much on, I will suffer and won't be able to do anything. And I will then suffer because I have put myself in a position that is not manageable. So the other thing I mentioned is fibro fog, or that's what we call it. So it's when you lose everything, lose your words. I'm doing it right now. These words don't come out. I can't think of what words to say or how to do things. But sometimes it gets to a point where you don't remember your name. And I've done that a couple of times on a phone call. Somebody has said, "Can I take your name, please?" And I can't answer the question. I couldn't think of the words for inhale earlier, and I was delivering a course earlier, and I couldn't think of the word inhale. Mine was compress your lungs. That's what came out. That's all I could do. But that's where fibro fog comes in, and words come out. But it can be really difficult because you feel embarrassed that you've forgotten words. You start to think, "Oh my God, I'm stupid. I can't think of things. I can't do this. I can't talk." But it's not your fault. This condition can have effects on everything. One of our tutors who also lives with fibro, if they've lost their remote control, their mobile phone, their car keys, the first place they look is the fridge or the freezer, because that is the majority of the time of the place where they've put it. But now they know that, they've made a note to themselves, like, if you're checking for keys, check the freezer or fridge. And it sounds silly and it sounds funny, but it's not. It's a horrible feeling when you forget to do things. But putting things in place, like putting a sign up to say, "Check here for this," can help. I have post-its all around my flat just to make sure that I know what things are. But it can be very daunting when you start to forget what to say and how to say things. Just having a conversation, you completely zone out halfway through. You have no idea what somebody else has said to you. And you're looking at them and you just don't take anything in. And like I said, it can be embarrassing, but do not feel like that. That's the easiest way to do it, isn't it? But there are ways to get around it. Like I've said, there are little things like post-it notes or explaining to people. So once you've explained to people, they're less likely to alienate you then for doing that. I talked a little about pacing and planning. So it's making sure that you do things that you're able to do and not things that you think you should be doing. Because in my personal life, I used to think I had to do everything. So I live alone, so all the cleaning and everything is up to me. Does it have to be done every week? If I can't do it, if I'm having a flare up, it's not essential. As long as I'm looking after myself, as long as I'm, I had my self-care and I've made food and I have things to be able to do, it's okay. Leaving the Hoover in for a week is not going to end the world, is it? But we put these pressures on ourselves to have to do everything. It keeps on going. And then we've got symptoms for fibro that you may not have thought that could have been related. Things like IBS, irritable bowel syndrome. That is a huge thing within people with fibromyalgia. Um, it's very difficult to manage on your own. You will need professional help with that. But there are lots of ways that can happen. So you need to speak to your GP in relation to anything like that. But it can also be your bladder as well. So if you find that you have to rush to the toilet or that you wet yourself, this happens with fibro. But there are ways that can help, and you need to speak to your GP in regards to that. But these could all be symptoms of your fibromyalgia. The other thing is restless legs or Willis-Ekbom disease. Sounds rubbish when you say it that way, but restless legs is fine. But it's just where your legs spasm and kick out and you can't rest and you can't keep still. And there are ways that can help that, things like massage and keeping hot and cold compresses on them, that can help. There are other ways, but speak to your healthcare professional, speak to your pharmacist to see if there's anything that can be done to help with that. I mean, one of the simplest ways is eat bananas. But eating a banana before bed helps reduce restless legs. If you don't like bananas, then you'll have to find something else that does the same thing. But it's just one of them simple things that can be done to reduce that stress and strain on your legs and help to relax to be able to sleep. Because sleeping is another problem with people with fibro. Because we struggle to get into a position where you're comfortable, you struggle to turn your mind off because you're still thinking of them words that you've forgotten throughout the day. Because it just let it go. And I know that's a simple thing to say, but use things like distraction techniques. So when you're trying to go to sleep, think of, say, count backwards in threes, but not from an easy number. My number that I normally pick is around 368, just something random. And then you have to count back, but you have to think about it. So because you're thinking about it, you're thinking of only one thing at a time. And you're able to concentrate on that, which takes it away from everything else, which can make you tired and you can fall asleep. The other thing that I do is if I'm really severely struggling with something and I need a complete distraction, is to think of 3 bands or music artists with every letter of the alphabet. I don't think I've ever got past O. I've normally fallen asleep. But but these things can really help to keep you going and to help you manage the symptoms that are there. I mentioned earlier about doing mindfulness, living in the moment, think about things you're doing right now. Because when you start to think in advance, your brain automatically goes to, I can't do this, I can't, it's too much, there's a lot going on there. I don't know how I'm going to feel, I don't know what I'm going to do. And then you put barriers to yourself. So kind of live in the moment a little bit more. It's very difficult to do, but it's something you can try and do. It's like, so try not to put barriers against yourself about doing things. If people ask you to go out, put barriers in place that you can do it, or put things in place for you to help you to do that and not to stop you. Stress management and relaxation are really good things to do. There are lots of stress management courses on on every council, actually, on their website. There's stress courses that you can go on and via the NHS. There are also we run courses about 5 ways to well-being. So we look at that in a quick session, a 2-hour session. But there are lots of other courses we do. So, like I said, we run the fibromyalgia course. There is also a living with chronic pain course that really helps as well. If anybody was interested in looking at any of our courses are at least 6 weeks. The fibromyalgia one is 8 weeks long. And we're looking at getting a course together probably around April time. Because it takes a lot of sorting out to get somebody available for 8 weeks, because all of our tutors are volunteers who also have long-term conditions. Over 75% of our tutors have fibromyalgia. So they are people who will understand and will be able to listen to you when you sit on a course with us. So where I can quite happily give my contact details. Well, Esther can give you my contact details or the website. You'll be able to transfer yourselves. If you do come in via this service, then can you please put in that it's via this that you've been referred, just so I know that my word has actually gone out there and been able to record that. But other than that, if there are any questions that anybody has, I'm happy to answer. I know there's only a couple of you in here right now, but Esther and Manmeet, if there's anything you wanted to ask, then I'm quite happy to answer.
I think for the sake of those listening and even on the recording, these courses, where are they run? Is it online?
The majority of our courses are online, and we find that with people with fibromyalgia, the best places to put them online is because sometimes it can be difficult to leave the house on some weeks. So we do the majority of our fibromyalgia courses online.
And they're free, yes? Did you say?
All our courses are free. Everything is free. There is no cost to anybody. You are given all the resources that you need. You will be given a workbook and any contacts that you need for anything. We will discuss anything you want. It's a safe place to share. And you will be with people that have the same conditions as you. Or if they don't have the same exact conditions, they will have the same symptoms as you. So they will be dealing with the same things. And we find that in the first week, we do an introduction session to the group and others. And at that point, everybody says the same thing. Or you're writing something down and everybody is nodding that they completely agree with you because they understand. And it's a place where you haven't got to explain yourself. You can just be. And that's what I think is really important about our courses.
So yeah, there was a question in the chat from Helen. So yes, there was an introductory talk that you gave on pain management. It is on our YouTube channel. You'll find it with the handle is at Thriving Communities on YouTube. But certainly, if you want to drop me, so you can send an email to hello@thrivingcommunitiescic.org. We can send you the direct link if you can't find it. Okay. Yeah, that's all I wanted to say. Have you got anything specific with regard to fibro? Any questions, any symptoms or problems that were not mentioned here and that you want some clarification on? Feel free to drop it in the chat if you don't want to speak, or just unmute yourself.
Yeah, another big one that's been coming up lately is tinnitus. That's been being mentioned by a lot of our participants. And I thought I didn't think that I had it. I just thought this noise was the noise that everybody heard. But I've now since been to an audiologist and I'm waiting to go to the tinnitus team because of, and that's all come because of fibro.
It's sometimes very difficult, isn't it? And then, this forgetfulness, some people think, oh, I've got something like Alzheimer's or just some form of dementia, and then it could be fibro.
Yeah, absolutely.
Or it could be people going through menopause and thinking, is it part of that brain fog or is it fibro? It's very difficult, isn't it? Just to pinpoint.
It is. But if you're having these symptoms, it's always best to go and check them out. Yeah. Always speak to a healthcare professional. They'll be able to help you. Or if you want to speak to a pharmacist, they'll have a lot of knowledge too.
Yeah. So it's mostly a function of lifestyle, is it? And the type of pressures that you put yourself or are subject to. And does it get to, is there a sort of statistics that show it happens, you say it happens more to women, and is it women of a certain age or is it indiscriminate?
It's normally around women between 25 and 35 is where they originally get a diagnosis. That seems to be that's from our research that we've done by doing these courses and things. It's not a generic statistic, but from our research into it, That's what it seems to be. But we are getting more and more men. Over the last year, the men that have been coming through for our courses has almost quadrupled.
Yeah, it probably is also a function of the fact that I think men are being more open and honest about their health
Yes,
and
yeah. Because I mean, it is a thing, isn't
including
it? Nobody
mental.
wants to discuss
Yeah,
anything. And there is especially as a stigma with men, there shouldn't be there because
no,
it is important to talk about these things. However, it's how we live, how we brought it from the past, isn't it?
yeah, it
And
is the conditioning.
unfortunately,
Yeah,
it's a don't say anything,
yeah,
suffer in
stiff
silence,
upper
and
lip.
that's not how we need to be. We need to be more open and honest because then that way we can make ourselves live a better life. We can be able to do more. We'll be able to, enjoy ourselves and not be put into the constraints of just living with these conditions.
Mm. Do you because we do focus a lot on breathing. Do you have a particular breathing technique that works for you?
Yeah,
Yeah,
diaphragmatic breathing really
yeah,
helps
the yogic
me.
breathing. Yeah.
Um, it's like being a baby again, isn't it? Because babies breathe through their bellies like the diaphragmatic.
Mm.
But as adults, it keeps going up and up into your chest. So it's getting that breathing back out of your chest and
Deep
back
down.
down into your abdomen. And I find that if at some point throughout the day, if I start to feel like I'm forgetting words or I just sit, have a couple of breaths, and I feel much better. It's something as simple as breathing can have a massive effect on how you are and how you cope with life.
Yeah. Oh, thank you, Amanda. That's been really, really helpful. I'm sure our listeners here, whether current or perhaps on the recording, will find this really useful. What we'll do is with the show notes, and the video or when it's uploaded to YouTube, we'll put your contact details
Yeah, that's
and a
brilliant.
link, email so that if they wanted to register for the course or any future course that you may be planning, if they've missed that deadline, then yeah, they can sort of put their name down and yeah, and
Yeah, absolutely.
option
Anybody can get
to
in touch with us,
yeah,
and we will be in contact with them then in relation to
yeah,
dates
yeah.
and what is going forward. We haven't got one in
Right
as
now,
such
no.
right now, but it is coming. We've got a couple more people training on it in the next week or so, and then we will have extra courses then put on.
And I know you mentioned sort of in a private conversation that you've actually found it so beneficial just being in a room or being, connected with other people
Uh-huh.
with who, can share
Absolutely.
the experience of the condition and, and what's worked for them. And sometimes you just still swap notes. But it's
Oh
just
yeah,
nice to have
but
people
on
listening
all.
and empathetic.
Sorry to interrupt. I didn't
Sorry,
mean to
yeah,
interrupt
carry on.
you. I just
Yeah,
I kind of do that. I have to apologize. But
yeah.
yeah, it's things like when we're looking at fatigue management, I learn something every session. The amount of times, I mean, and I delivered these courses for 2.5 years, and I'm still learning things every session we do. So, and I write it down and I try it. I've tried so many different things, and it's some of them have worked, some of them haven't, but it's always worth a try. And I think that you're the expert in your own health. So if something works for you, it may work for somebody else, but it may not. But it's worth a try.
Yeah.
We don't mention any sort of medication because we're not healthcare professionals in our courses. We do more of the holistic side of approach to it and looking at self-management. And I think that, we can only help each other. And I think that us as people who live with long-term health conditions, I think we're the best people to talk. And we don't often get that chance.
Mm.
So I think, that's a huge benefit of being on one of our courses.
Most definitely, yeah. Oh, thank you. Unless anybody's got any further questions that have not been covered, we'll conclude that. Unless, yeah, you're pretty much covered on your subject now, Amanda. Is there
Yeah.
anything? Yeah, lovely. And once again, thank you very much for giving this talk. I think people will find it helpful, and yeah, and we may get in touch again because I know you have a number of other interesting topics that you cover. Helen, you got yourself off mute. Is there something you wanted to ask? Oh no, she changed her mind. It's fine. It's
Yeah,
fine.
that's okay. That's fine. You know,
We don't want to put any extra stress on people who are suffering anyway.
no, you know, sometimes it's just taking that information in takes a lot out of people with
Yeah,
living with fibromyalgia. So
just sitting
it
here
takes some
listening.
time to actually work in. So any questions that are asked on the YouTube channel, I will have a look because I I'm subscribed to the YouTube channel.
The
So when it
comments,
comes up,
yeah.
I will keep that video on, and if any,
Oh,
I'll put my contact in there as well. Then just so if you need to contact me for anything, then you know it'll be on that
fabulous.
as well.
Okay, thank you very much, and thank you to the rest of the team at the EPP team because they're doing a great job. And yeah,
Thank you.
long may it be funded to continue.
Fingers crossed.
Yes, exactly. As we hope as well with our
Yeah.
initiatives. Yeah, but thank you very much for your time, and thank you for all our visitors or those who have joined the call. Appreciate you joining live today, and have a great day. Bye.